What happens to lung function after lung cancer surgery? When someone undergoes lung cancer surgery, it can change how well their lungs work, but the extent depends on the type of surgery and their overall lung health. After surgery, especially procedures like lobectomy or pneumonectomy, patients often notice a drop in lung function right away. This happens because part of the lung tissue is removed, and anesthesia and surgery can temporarily affect breathing. Tests like forced vital capacity and forced expiratory volume in 1 second usually show a decrease immediately after surgery. Over the following months, many patients see their lung function improve gradually. For example, after removing a lobe of the lung capacity might decrease by about 7 to 13%, and airflow measures like FEV1 might drop around 8%. If a whole lung is removed, the decrease can be more significant, with lung capacity dropping by about 30% and FEV1 by nearly 25%. But the good news is that lung function often recovers over time. Studies show that by 3 months after surgery, lung function can improve noticeably, and by 6 months, it may be close to pre-surgery levels. After about a year, lung function tends to stabilize, especially in measures like the diffusing capacity, which shows how well oxygen moves from the lungs into the blood. Several factors influence how well someone recovers. The more lung tissue removed, the greater the impact on lung function. Patients with pre-existing lung conditions like chronic obstructive pulmonary disease may experience slower or less complete recovery. The surgical approach also matters. Minimally invasive techniques like video-assisted thoracic surgery often lead to faster healing and better lung function outcomes compared to traditional open surgery. Post-operative care, including physical therapy and pulmonary rehabilitation, can help improve breathing and overall recovery. Patients should be aware that some may experience ongoing symptoms like shortness of breath, fatigue, or discomfort. These can usually be managed with proper medical care and rehab programs. Regular follow-up with healthcare providers is essential to monitor lung function and address any issues early. Engaging in breathing exercises and physical activity tailored to individual capacity can also support recovery and help improve quality of life after surgery. Remember, each person's experience is unique, so personalized medical advice from healthcare professionals is always the best guide.